All right, welcome back. Now, yes, on Wednesdays, well, it's usually Tuesdays we talk health, but today we have something important that we needed to make sure we talked about today. And we have a catalyst for change in the healthcare sector with us, Folake Owodunni. And she's going to be talking to us a bit about emergency response and so much more. Welcome to the show.
Thank you. Thank you for having me.
All right, so Emergency Response Africa, right? I hope I got that right.
Yes, correct.
Fantastic. I remember watching a lot of movies as a young person, thinking about, you know, the emergency response teams they have in America and the, you know, in Europe and all that. And when I think of emergency response here in Africa, it doesn't really, you know, no balance. Let's just put it that way. And I know you probably have had that kind of response before when having this conversation. You need to let us know why you decided to take on this project and how it's been going.
Absolutely. So Emergency Response Africa came from a place of personal experience.
Okay.
Several years ago, I had an emergency with my son.
Oh, wow.
But it happened outside Nigeria.
Okay.
And so kind of like, you know, what you're saying, I called 911 and the response was so prompt and straightforward that I couldn't help but think if the same situation had happened outside in Nigeria, it would have been a very different outcome. So, I mean, absolutely, we're not there yet, for sure, but Emergency Response Africa started because we felt that just because we're in Nigeria doesn't mean we shouldn't have access to a 911-like system. And that's exactly what we do. We connect people to help when they have an emergency. Okay,
all right, so this is... I don't have any other word to use, but a private version of the emergency response that, you know, would have come from public health care?
Interestingly, yes, but we do actually work with the government.
Okay.
So we work across the private sector and the public sector. I mean, if you think about what emergency services is, it's for everybody. It's not just about one person who can afford to pay. So for us, it's been very important that in as much as we're serving the private sector, individuals, corporate, we also work with the government to make sure that even the most underserved can actually access the service when they need it.
Fantastic to hear that. I saw a hashtag, 1,000 ready to serve?
Respond.
Over to respond. And I was just, I was trying to figure out how you plan to go about this and what that campaign is really targeted at.
Yeah, so 1,000 Ready to Respond is a campaign that we've launched to train and equip and certify 1,000 Nigerians in first aid and CPR before the end of the year.
Okay.
And you wonder, you know, why? Why is this important? One of the biggest problems that we've seen in delivering emergency services in Nigeria is awareness and education. And I only need to point to a few examples. You know, we had some time ago the situation with Junior Pope and, you know, the drowning and all that he went through before finally passing. Even recently, we lost the national treasure, Onyeka Onwenu. Again, the circumstances show us that if there was just timely intervention, those people might have actually had a chance to survive. And the reality is those are the names we know. There are literally over 1 million every single year in Nigeria that we don't know that die under those circumstances. And so for us, you know, we're on a mission this year to make sure that at least 1,000 people can be equipped with the skills to intervene in a manner that actually helps to increase the likelihood of that person surviving.
Okay, so CPR is very, so there are basics of CPR, but then there are also some other interventions that could come in with things like machines, defibrillators and things like that. So that's going a step further. Are you going that far? You know, because CPR, chest compressions and mouth-to-mouth is one thing, but just going the extra mile like they would abroad, they probably have defibrillators in big, large buildings.
Absolutely, absolutely. So, I mean, we need to think of emergency response as a continuum, right? It goes from whatever happens at the scene when there's an emergency all the way through to the hospital when the patient is actually brought. And this campaign is really focused, of course, on that first initial response. Anything that you or I can do, you know, to at least keep the person okay.
Okay.
However, when you're training someone, one of the things we talk about is the chain of survival and the importance of actually activating a professional response, which is why we're not just a training company, right? We don't want to just train the public. We also want to make sure that that professional response is available. So you as a first responder, okay, you see somebody, you clearly they need CPR, you start administering. You cannot do that forever. You need to have the professional responders come, and our professional responders will come with an automated defibrillator. So they're able to apply that, and then they can actually transport the person to a hospital using an ambulance. So
when did this begin, and since that time, how many people have you been able to respond to? I'm going to use that term.
That's a good question. Yeah, that's a really good question.
I'm not going to say how many did you save.
I mean, yeah, that's a good question. So we started about 3 years ago. In that time, we've done about 5,400 incidents. I mentioned also that we work with both the private sector and the public sector. So that covers anything from somebody in their house, you know, a pregnant woman who has gone to a primary healthcare center and is having, you know, labor complications and needs to be taken to a hospital for intervention. It covers, like I said, you know, the public sector work that we do, where, you know, even a person that's maybe on the road that's destitute, all of those people are encompassed in that number. So we've really been able to see some tangible impact.
It's actually very impressive. You mentioned earlier that you've gotten involved or, well, started partnerships with certain governments. Which ones have been the most responsive so far?
Ooh, that's a good question. We've had many conversations. But maybe the one that I'll spotlight is Edo State government. So last year, we kicked off a partnership with the Ministry of Health. And in that partnership, which is partly funded by the government itself, partly funded by a development partner, we've trained 200 community-based first responders. So these are people that are already out and about in the community. You know, we can use technology to activate them at a moment's notice, and they get to the scene in about 5 minutes, and they can start that first aid, that CPR, you know, whatever is needed. And then we can now connect the ambulance services, which we help the government to manage, so that the ambulance can come and pick up the patient and take them to the hospital. So we've really worked very closely with them, and they've been very responsive. There are a couple of other states we're kicking off work with now, Ogun State, Rivers State. So we're very excited that there's a response.
So there was a term you used, and I'm going to come back to that now, tech. How is tech involved? How have you infused tech in this entire service at the Emergency Response Africa, right?
Yes. So tech plays a central role. If you think about an emergency response, what it takes to go from a patient on the road all the way through to the hospital, there's a lot of communication that needs to happen. There's a lot of data exchange that needs to happen. How do you know anything about this person? What is the right treatment? What if they have a pre-existing condition? Those are all things that, you know, we don't necessarily know and we don't necessarily communicate. So what tech helps us to do is identify the closest available response team that can come to that person's aid, but also then communicate information about the patient all the way through to the hospital level.
So now I have to wrap it up now, I'm afraid, but I have to say thank you so much for what you're doing, and good luck with the next stages, next steps. Emergency Response Africa. I'm definitely going to be looking out for what you guys are
come get trained. We want to train you guys.
So I actually would like to, you know what, why not come do a training here on the show?
That would be fantastic,
And we can show everyone exactly what you mean.
Absolutely.
All right.
Awesome. Thank you so much.
Thank you so much, Folake. At this point, we're going to wrap it up on this conversation, but we know the conversation continues right there online. Use our hashtag #WakeUpNigeria on TVC and tag us WakeUpNigeria TVCE with your questions, comments, and contributions. We can't wait to see them.